appreciate everybody coming out. Really appreciate it. Especially with, I think there's some snow in the forecast and stuff. So just, be careful this afternoon, especially if you have arthritis. Don't want any falls or injuries, okay? So I'm Ben Snyder. I'm going to be talking to you about arthritis. I'm going to be explaining essentially what arthritis is, why we get it. It is a very natural, common process in our bodies. And essentially what you can do to live with it better, so to keep it from, getting worse, keep it from flaring up, and just kind of essentially live a better life, with arthritis. So this is a very, very informal talk. So if you have any questions along the way, just raise your hand. We can try to answer them as we go along. If you have a more personal question, I'll stay afterwards and we can talk more one-on-one. But it's supposed to be educational. You'll see it's going to be a little bit interactive. And hopefully, you learn a lot and you take, something out of it to help live a better life. All right. So, just a little bit of background on myself. I'm an orthopedic surgeon. I'm board certified. I specialize in hip and knee arthritis. I do hip and knee replacement surgery, but a lot of arthritis does not need surgery, okay? I'm originally from Pennsylvania. I went to Penn State and studied mechanical and biomedical engineering. Then I came up to New England for medical school at Dartmouth about 20 years ago. Did my residency training at UMass in Worcester. Met my wife, who's from Massachusetts. And then went out to California for a year of specialized treatment of hip and knee replacement surgery. I currently practice here in Springfield at Mercy Medical Center. But I have a background in public health, master's in public health. And the basis for this talk really is that a lot of patients come to my office and they've been referred, by their primary care doctors, or they come in themselves and they have, pain in their knee, they have arthritis. And a lot of times patients have not been told what arthritis is, why they have it, what they can do about it. And so they show up and they're very uneducated and not informed. And so this is essentially what I'd be talking to patients about the first time that I would see them. So again, giving background on arthritis, why it happens, what we can do to live better with it. All right. Anybody else come in late that needs a handout? Okay. Maybe I'll just give you a few and you can hand them out as we go along. All right, so what is arthritis, okay? So arthritis simply is the joints in our body wearing out with time, all right? So our joints, this is a knee joint, okay? We have the bones that form the joint. At the ends of the bones, there is this articular cartilage, all right? That articular cartilage is that smooth, lubricating surface of the bones, and it acts like a cushion. It's like the white end of a chicken bone, if you're eating a drumstick, all right? So within the joint, there is usually some type of what we call fibrocartilage, which adds some additional cushioning. In the knee, it's the meniscus. In the hip, it's the labrum. In the shoulder, it is the labrum. And that ends up providing some additional cushioning that helps protect the cartilage at the ends of the bones. And then the joints are supported by ligaments, usually within and on the outside of the joint. There is a lining of the joint that's called the synovium. And that's what produces the joint fluid, which provides the lubrication in the knee, kind of like the WD-40, all right? So you need all those kind of working together in concert, all right? And so what arthritis represents is a breakdown, particularly in the ends of the bones and that cartilage, and then the supporting structures, within the knee, all right? So there's different types of arthritis. There is osteoarthritis, which is the wear and tear type of arthritis, or what we call degenerative joint disease. There is inflammatory arthritis, which the most common type is called rheumatoid arthritis, but there's also psoriatic arthritis, and there's also inflammatory arthritis associated with certain inflammatory bowel conditions, such as Crohn's disease or colitis. And then another type of inflammatory arthritis is infection. If you get an infection in the joint, it causes inflammation that causes the joint to break down. And then the third type of arthritis is what we call post-traumatic arthritis. And that's when there's been a prior injury or surgery to the joint that has caused that joint to break down, okay? The common endpoint in the joint breaking down is that this cartilage, that articular cartilage, starts to wear out, all right? And I usually explain it's like treads that wear out on a car tire, all right? And as it wears out, those bones get closer and closer till it's completely worn out. You know, like the tire is bald, and that's when it's bone on bone. And we'll talk a bit more about that later, all right? So that cartilage can wear out just from the wear and tear, like driving your car like 30,000 miles on a single set of tires. That inflammation can cause that cartilage to wear out, or the infection can cause that to wear out, or that injury can cause a damage to that cartilage and cause it to wear out. As that cartilage wears out, the meniscus or the fibrocartilage cushions in the knee also start to break down, and they can develop tears. So it's very common to get a tear in your meniscus when you develop arthritis in the knee, or a tear in the labrum when you have arthritis in your hip or your shoulder. The lining of the joint, that synovium, usually becomes very inflamed. When it becomes inflamed, it produces a lot of excess joint fluid. And that inflammation in that joint fluid is what causes that joint to swell. It's what causes it to turn a little bit warm or become sore. And then as those protective items in the joint start to wear out, the bone starts to see more forces, all right? It's no longer being as cushioned. And things that develop are what we call bone spurs or osteophytes. The bone will become harder, which is what we call sclerosis. And if it gets really bad, you can develop cysts or little holes in the bone, all right? So again, arthritis, you know, whether it is the wear and tear type, whether it is the inflammatory type, or whether it's, you know, post-traumatic type, it's the wearing out of the joint, all right? And it's like, you know, again, treads wearing out on a car tire, all right? And there's certain things that predispose to arthritis, all right? All right, any questions about that? No? Okay. All right, so there's certain risk factors for arthritis, all right? So as we get older, it is more common to develop arthritis. And again, going back to the car tire analogy, the longer you have the car on the tire, the more likely it is to wear out, okay? Our bodies are only designed to last about 60 years, all right? After that, things just start to wear out, all right? It's like a car after about 100,000 miles, things just start to break down and wear out. So arthritis is a very normal, common process of aging. So apologize, but you know, we're all in that boat. We're all getting older. It's just with the...
It's inevitable then? There's no way to avoid?
Well, there's things that you can do to avoid it or cause it to slow down or to keep from getting aggravated. And that's what we're going to go through. And that's what is on your sheet there, okay? Yeah, I was just actually looking, there was a study this morning that was in my email. So rotator cuff, I don't know if you know about what a rotator cuff, those are the muscles in your arm. There is a study out of Finland, and they did an MRI of like 2,000 people, and they found that people, the average age was 58 years old, and in 99% of people that were 58, you know, they had some abnormality in the rotator cuff. You know, so it's a normal wearing down process in the body. Okay. So as we get older, you know, it was more common to develop arthritis. Unfortunately, being female, for some reason, the genetics, that cartilage is more susceptible to wearing out. Being overweight, that causes the joints to wear out sooner. And the analogy I use is a pickup truck where you're putting like a ton of bricks in the back, bed of that pickup truck. It's probably going to cause those tires in the back of that truck to wear out sooner. All right, if you've had a prior injury, so again, going back to the tire, if you hit a big pothole and it scrapes off part of the tire and they put a patch on that tire, it's more common that that patch is going to break down and that tire is going to wear out sooner, all right? If the muscles that support the joint become weak or you're not being as active, that can cause the joint to wear out sooner. And so one of the main goals, the primary goal here, is to try to stay active as you get older, all right? Malalignment, so in the knees, we always talk about, knock knee, what we call valgus, or bow-leggedness, or what we call varus. In the hips, it's what we call dysplasia, where the socket or the ball have not formed normally. And that puts abnormal forces through the joint that causes it to wear out sooner. And again, the analogy of the car tire, if you have a car tire that is malaligned or riding up on edge, it's going to cause that car tire to wear out sooner, okay? And then there are certain activities that just put a lot of excessive stress or force through the joints. And we're going to go through some of these. These are the things you want to try to avoid if you do have arthritis. And that's, deep kneeling or squatting, like getting down and off the ground or the floor, okay? Or doing a lot of really repetitive heavy lifting, all right? All right. Any questions about any of that? Yeah, in the back.
When your shoulders, when you raise it like that, and you hear it clicking it up,
yeah.
Anything?
It's probably arthritis in some way or another. You probably have an issue with the rotator cuff or the labrum in there. Yeah. It's unfortunately probably a breakdown, of the shoulder joint. Yeah. What I tell patients, it is normal to have some clicking in a joint. I put patient's hand on my knee. I have clicking in my knee. It's not painful. It's normal. We all can crack our knuckles. You're not doing any damage to the joint. So if it's just clicks, that can be normal. But if it's a painful click, that's probably something abnormal. Okay. All right.
Oh, what do you mean by dysplasia? What's that?
Dysplasia. That's so it's a fancy medical term for that the joint hasn't formed normal. Okay.
Misalignment.
Yeah, so in the knees, it tends to be malalignment, like knock knee or bow-leggedness. In the hip, it's dysplasia where the socket or the ball haven't formed normally. So
That's something you're born with? Born like that?
Yes, usually it's something you've had since early childhood, yes. So, all right. And am I talking loud enough?
Very good.
All right.
Very good.
Sorry. Yeah, just let me know if I'm talking too loud.
No, not
some
too
of my
loud.
patients, I'm a little bit hard of hearing myself, so. All right. Yep.
Arthritis versus calcium buildup. I've had both things said.
Yeah. So calcium buildup is a type of inflammatory arthritis, and I apologize, I should have mentioned that. So that's gout or that's pseudo-gout. And what happens is usually because of some nutrition or medicines, calcium crystals get deposited within the joint or the muscle or tendon, and that causes very significant inflammation. Yep.
What would cause the crystals to build up?
Nutrition or certain medication. Certain medical conditions, certain medications, and certain diets or nutritional things. Yeah.
Because, I guess you can have these calcium deposits in various parts of your body, like
Yeah.
your I don't know.
Well,
heart.
yeah, so that's a different type of calcium.
Oh,
so
different
that's
type of calcium?
Yeah, so that's it's still an inflammatory process. It's that's vascular disease or disease of the blood vessels where you develop calcium that then can break off and cause a plaque and then cause a clot. That's part of the inflammatory process as well. But it's it's calcium. It's but it's inflammation. Yeah, but it's a different.
The calcium crystals building up in the joints, can you get that from taking calcium supplements?
Usually not. No.
Okay.
Yep. Yeah, and most postmenopausal females should be on some type of calcium, whether it's through the diet or whether it's supplements, and that's to help prevent osteopenia or osteoporosis, which is different from arthritis. Osteopenia or osteoporosis means that the bones are weak, all right? That is different from osteoarthritis, which is, wearing out or arthritis or inflammation of the joint.
Oh.
Okay? Two very different things, okay? Everybody clear on that? All right. Okay. All right. Next slide. All right, so arthritis, like we said, it is very common, all right? I just told you about the study I saw this morning with the rotator cuff. Based upon national surveys here in the United States, over, 1 out of 3 patients, 37% of people more than 60 years of age will have some knee arthritis in their body. It is very, very common. Arthritis in your back is very common. 50% of people more than 50 years of age are going to have some type of back arthritis. As far as, where arthritis occurs, it is most commonly in the knee and then the hip, and then the hand, and then in the hip, all right? It's just unfortunate that, the knee and the hand have very poorly designed joints. In the hand, it's mainly the bottom of the thumb here. That's a very poorly designed joint. The knees are very poorly designed joints. The back just sees a lot of stress, and that tends to wear out as well, all right? So, okay. All right, so arthritis, very common, it's something that unfortunately develops as most people age. There are certain things that put you at risk for developing arthritis. So it is very common for people to develop it as they get older. And so there are certain things that you can do to try to live better with arthritis, all right? And so I put together this slide. I call it the 4 pillars of, living with arthritis, or the long-term treatment of arthritis. And the goal here is at the bottom, it's to maintain a healthy joint and to prevent further damage and injury, okay? So it's like that car tire. There are certain things that you can do to keep that tire from wearing out further and needing to be replaced or fixed, okay? All right, so we're going to go through this one step at a time. And all of this is very evidence-based. It's supported by a lot of studies, by arthritis organizations, by my academy, the orthopedic surgeons. So all very evidence-based stuff, okay? All right, so the first pillar, and this is the most important pillar, is that you continue to stay active doing low-impact activities, all right? It's that motion, it's that activity that keeps the joint healthy, helps keep that cartilage healthy and nourished. Our cartilage gets the nourishment from that fluid in the joint, and every time you take a step and you step off, it's like a dry sponge, or a sponge that you step down and off. It absorbs that fluid, it absorbs the nutrients, and that's why activity is very important to help, delaying or preventing arthritis, okay? So what do I mean by low-impact activities, all right? So these are all examples. Walking, biking, swimming, ellipticals, treadmill, even hiking. You might want to take some hiking sticks or trekking poles if you're going on uneven ground or snowy, icy ground. But it is safe to do these activities. You are not going to be doing damage to your joints by doing these activities, okay? So the sayings that I tell patients, motion is the lotion, or if you rest, you rust, okay? So you try to keep moving, all right? The other saying I have is that arthritis is hurtful, it's not harmful. And what I mean by that is by doing these activities, you might develop a little bit of soreness in those joints that are arthritic, okay? A little bit of soreness is okay. And what do I mean by soreness? So we all think about pain or soreness on a scale from 0 to 10, all right? 0 is no pain at all. 10 is like the worst pain imaginable. So that's like childbirth in females, and it's like being hit by a truck for us males, all right? So 3 out of 10 is enough to make you maybe grimace a little bit of discomfort, so that is fine, So the point is to find an activity level that you're not going to be developing more than 3 out of 4 pain in that joint, either during that activity or that evening or the next day, okay? And we all have different levels of activities of what we can do, all right? So, so this is, where I usually ask, the senior centers, what type of activity programs do they have, all right? And you have a lot of programs. You have a fitness room, which is self-guided. There's balance training. There's chair exercises. There's the stretch and strength everything class, the silver sneakers, the strength circuit, and Tai Chi can also be very helpful just to keep moving and to help with your balance. Also the yoga at Brownstone. Yoga is also very helpful to keep moving and help with strengthening. And we're going to get to why strengthening is also very important, okay? So why the poles, or a cane can be very helpful is that, using those helps transfer some of the weight that would normally go through that joint, into your hand and the pole or the cane that you are using, all right? And we're going to get into this in the next slide, but using those helps with balance, but it also helps offload the stress and the weight and the force that is going through that joint, all right? So that's why, you find whatever you need to do to try to keep moving. And if that means using a cane, if it means using trekking poles, if it means using a walker, whatever you need to do to maintain the mobility, try to do. We just want you to stay active, but you want you to be safe about it. So that means not having any falls, stumbles, or injuries. Okay? All right. Any questions about? Yep. Go ahead.
In the exercise room, they have recumbent parts.
Yes. Very helpful.
Oh, it's not on your list. Okay.
Yep, we're going to get to that. Yep. So bicycling it's an activity, all right? It's a low impact activity, but it's also a strengthening activity, all right? Yeah, and so brings up a point. So the reason I circled, in red, the biking and the swimming is those are the two most low impact activities that you can do, but they're also very helpful because they also strengthen the muscles. Walking keeps you moving, the ellipticals and the treadmills keep you moving, but they're not as much strengthening activities. The biking and the swimming are also strengthening, and we're going to get to that. That's the last pillar here, is why strengthening is important, okay? But it can be sometimes tough to find a bicycle or a pool, to exercise with. Biking, there's the recumbent bicycles, there's the stationary bicycles. They even have the things that you put on the floor, the little pedals that you can kind of do when you're watching your Jeopardy or your nightly news. Swimming's a bit more difficult, because you obviously need a pool for that. But the goal is just keep moving, all right? Motion is the lotion. If you rest, you rust, all right? Keep moving. All right. Yeah, in the back.
Swimming, there's a lot of different kinds of swimming. There's backstroke, there's butterfly,
Yep.
the overhand.
Yep.
Some of them are painful.
Well, like I said, that's where this soreness, it's okay to have a little bit of soreness, like 3 or 4 out of 10. But if it's causing you pain or soreness that's above that, all right, you're probably doing too much, or you're doing it wrong, or you switch strokes. Okay?
Still do it.
Try to keep doing it the best that you can. Yeah. Yeah, you should not be doing more damage to your joints doing those simple activities as long as you're not causing excruciating pain. Okay? All right. Any other questions? Yeah? No? All right. Move on to the next one. All right, so the next one is there are certain activities that you should avoid, all right? And you should avoid these if you have arthritis, okay? So the activities that you want to try to avoid, and these are activities that put a lot of excessive stress or force through the joints, all right? So that's high impact stuff like running and jumping, all right? Most people with arthritis aren't doing those things. And we've all heard about or read about, the 90-year-old that's running marathons, okay? I can guarantee you that, they probably do not have arthritis in their joints, all right? Some people are just blessed, they have good genetics, they've done all the right things in life, and they just have not developed arthritis, all right? So, if you don't have arthritis and you're not causing excruciating pain, you can do those things, But if you do have arthritis, you should try to avoid those, all right? The other things are, and this is repetitive, deep kneeling and squatting and lunging, okay? So this is like the deep, getting on and off the ground or the floor like repetitively, okay? And the reason is that doing these activities puts a lot of excessive weight or force through your joints, okay? BW here, that's your body weight, all right? So going up the stairs, you're putting over 3 times your body weight through the knees and the hips. Going down the stairs, it's 5 times your body weight. Jogging, it's 7 times. Squatting 7 times. Deep squatting, it's 20 times, all right? So if you weigh, 100 pounds, just going down the stairs, you're putting 500 pounds through your knee and through your hip with every step. If you're doing a deep squat, that's 2,000 pounds. That's a ton, all right? Most people weigh a bit more than 100 pounds, though, all right? So if you weigh 200 pounds, then you're doubling that, all right? You're putting 1,000 pounds through the knee just going down the stairs, and you're putting 4,000 pounds through your knee doing a deep squat. That's 2 tons. That's the weight of a small car, all right? So that's why you try to avoid doing those repetitively. So something that I found is very helpful for people, that like to be outside and gardening, weeding, putting in flower beds, or even, doing some stuff around the house is, I call this a gardening step or a gardening stool, all right? They have them at most gardening centers. You can get them online on Amazon or Target or Walmart. I think, they're probably $40, $80 if you get them at a fancy place. But what this does is, you can stand it up and you can sit on it, so you're not having to get on and off the ground to do your, weeding and flowering. Or you can flip it around and it has this nice foam pad on it, to cushion your knees. And then you have these handrails to help get you on and off the ground. This works in the same way of using a cane or those walking sticks. Instead of all the weight going through your knees to stand up, some of that weight is now going through your arms and your hands, all right? So you're helping to offload that knee. I see a lot of patients in the springtime, because, they've been inside all winter, not doing a lot of activities, and then the weather gets nice, sunny, and they want to get outside and weed and plant, and it's the up and the down, and they aggravate the arthritis in their knees, all right? So, so if you have to get down, you try to stay down, If you're going to be getting up and down repetitively, then try maybe getting one of these, gardening stools, all right? Yep, go ahead.
Where does getting out of a chair go fit in there?
Yeah, so getting out of a chair, as you probably know, if you have a chair that has arm holds, it's probably easier to get out of, okay? If you have a chair that's sitting up higher, it's usually easier to get out of because you're not going as deep down, all right? So we're going to go through some strengthening exercises, that are on the back of your handout. That if you do them, on a fairly regular basis, either every day or every other day, will probably allow you to stand in and out of a chair a lot more easily, okay? And we're going to go through that. We're going to get to that, okay? All right, so any questions about that? No? All right. All right, so just as kind of a reminder, this is all very evidence-based. It's supported, by my national organization of orthopedic surgeons, by the Physical Therapy Association, by national arthritis organizations. So good evidence, teaching patients about arthritis, doing some supervised exercise, how to manage that arthritis, and using canes, sticks, or a walker can be very helpful to improve, the symptoms of arthritis, okay? All right. All right. So the third pillar, and this is often the toughest or sometimes most personal topic, is maintaining a healthy body weight, or losing weight if you're overweight, okay? So when we talk about weight or body weight, we're usually talking about a BMI, all right? BMI stands for Body Mass Index. And it's a way to normalize your weight according to how tall you are, all right? So if you have a person that's 250 pounds, and they're like a 7'5" basketball player, they're going to be like a string bean, very tall, very skinny, all right? But if you have that same person that is, 4'10", or they're probably going to look like the blueberry girl from Willy Wonka, okay? So two very different body shapes there, but the same weight, all right? So the goal BMI, is about 25 to 30, all right? And as we get older, it has actually been found to be healthy and okay to be closer to that 30, even into the low 30s, all right? Where you start getting into trouble is if your BMI is, at 35, or especially if you're up towards 40 or above 40, okay? It's in those patients that really weight loss really makes a difference, okay? So the saying I have with my patients, every step that you take, you're putting about 5 times your body weight through the knee, all right, and the hips. So what that means is every pound that you lose, is 5 pounds less through your joints. So if you're able to lose 20 pounds, that's 100 pounds less through that joint with every step, okay? So if your BMI is in that 25 to 30 range, your goal is just to kind of keep it there, okay? But if you're much above that, then you really need to be thinking about, losing some weight to help offload the joints, okay? So when you think about weight loss, there are 4 ways to lose weight. There's exercise, there is diet, there is medicines, and there is surgery, okay? So as far as exercise goes, 1 pound of fat is about 3,500 calories. And 3,500 calories is what you burn if you run a marathon, all right? And so I do not expect anybody with arthritis to be able to run a marathon in a week, probably even in a month, okay? Maybe not in several months, okay? So most people with arthritis, unfortunately, it's going to be tough to lose weight, with exercise. You're just not going to be able to do the amount of exercise that you need to do to lose weight. So then you're thinking about diet, and you're thinking about medicines, and then you're thinking about surgery, all right? So as far as diet goes, again, 1 pound of fat is about 3,500 calories, all right? So if you can figure out a way to cut out about 500 calories per day, that's about a pound a week, all right? So the easiest way, to lose weight is to try to think about, sugary snacks, sugary drinks that you have between meals, all right? So, you eat your normal breakfast and your lunch and your dinner, But if you get hungry or thirsty between then, try to avoid the sugary fruit juices, the sugary sodas, the cookies, the pretzels, the potato chips, all right? Try to substitute water, or diet fruit juice or diet soda. And instead of, the pretzels and potato chips, substitute vegetables, okay? So, I had put together a slide on, there are certain foods that are natural anti-inflammatories. So they help fight that inflammation. And again, it's inflammation, which is what causes the pain, which is what causes the swelling, which is what causes the warmth, okay? So the number one food that you can eat to help, that's an anti-inflammatory, is cruciferous vegetables, all right? So examples of those, it's the dark leafy greens, all right? So it's spinach, it's broccoli, kale, cabbage, cauliflower, arugula, all right? Brussels sprouts this time of year, all right? So those have a lot of natural anti-inflammatories in them. There's certain herbs, turmeric, it's a spice that you can add to your food. It also is a supplement that you can get over the counter. There's actually very good evidence that it's a very natural anti-inflammatory for you. Ginger and garlic, also good natural inflammatories. Dark chocolate, if you like chocolate, then maybe try to go with the dark chocolate. There's actually some natural anti-inflammatory properties with that. What you want to avoid are seed oils, and those are, corn, canola, soybean, sunflower, grapeseed oils, okay? And when you think about anti-inflammatory foods, this is a handout that I give to patients, you tend to think about like a Mediterranean diet, all right? So, actually tomatoes and, what are they called? The sunshade vegetables? What are they called? Nightshade vegetables. There's actually mixed evidence about that. So tomatoes, there's a little bit of a question mark there. I got called out on that in one of my presentations, all right? But fruits, nuts, olive oil, okay? If you're going to use oil, olive oil, very, very good for you. Those dark leafy greens, cruciferous vegetables, and then fishes, salmon, tuna, okay? Especially those fatty, oily fishes, okay? The things that cause inflammation, unfortunately, these are the ones that taste the best, okay? These are, fried foods, sodas, refined carbohydrates, those are like your white breads and your cookies, lard and, processed meats and such, okay?
I never thought about soda. Why would soda be inflammatory?
So the sugars involved with it.
Oh, sugars?
Yeah, like the artificial sugars.
Oh,
yeah.
it's not the carbonation in the soda.
No, not the carbonation
Okay.
at all. No,
Okay.
no. Yeah, so I was going to say, and even, I think, if you like soda, at least substitute, diet soda or like the 0-calorie sodas, instead of like the regular sodas. Think of soda as like a treat, it's like, or dessert. Maybe eat dessert every night, but, maybe like once a week sort of thing, all right? So, yeah, go ahead.
See, what's the issue with tomatoes? It's a staple in a lot of cultures.
I know, yeah, so it's not my area of expertise, but I think it's considered a nightshade vegetable. And if anybody knows more about this than me, please speak up.
What did he say?
So what about tomatoes?
Oh,
Yeah, so it's considered a nightshade vegetable. And I don't know, there's some evidence out there that the nightshades actually promote inflammation, you know. So does anybody know anything more about that? Yeah, I'll have to look into that.
To avoid tomatoes.
You avoid tomatoes, yeah. So, yeah, if you remember Tom Brady followed a diet, you know, and you know, it's a lot of stuff that he followed. And I think I remember hearing he avoided tomatoes. So I don't know. I don't want to put a bad thing on tomatoes. I think tomatoes probably okay. You know, like I think there's a lot worse things you can eat. So, but I'll try to look into that because it is a question. The nightshades that they do come up. Yep.
The natural sugars in fruits are okay?
Yes. Yeah.
So you can make snacks like blueberries?
Yeah, so that's the thing. Blueberries, and I think it's a lot of times there's a lot of antioxidants in those as well. I know especially blueberries have a lot of natural antioxidants. Antioxidants, they're natural chemicals that actually help, you know, I don't know, they break down the products of inflammation. So, yeah, antioxidants. Yeah. Yep, go ahead.
Dried fruit, all right, or better than?
Dried fruit? I think that's fine, yeah. I think dried fruit's fine. Yeah, and I think it has a lot, no? Oh, okay. Well, it's not sugars. I think it's a trade-off. I think it's better than eating like pretzels and potato chips and cookies, yeah. I know it has a lot of fiber in it, so it can keep you regular, so. So I think there's trade-offs, yeah.
Not as good as real fruit.
I think real food is good, yeah, better. You know, I think you get filled up sooner, so you're not overeating that, yeah. So. Okay. Yeah, again, nutrition, not my area of expertise, but just a little aside on things that you can eat, you know, or avoid that help with inflammation, you know, which arthritis is inflammation. All right. Okay. All right, and you know, again, you know, good evidence behind, you know, losing weight to help reduce the symptoms of arthritis. Okay. All right, and the last pillar, that's going to be a little bit interactive. Strengthening exercises, okay? So strengthening exercises, they help in two ways, all right? As you strengthen the muscles that cross the joint, that causes those muscles, tendons, and ligaments to tighten up and tighten down, and it acts like a natural brace to help stabilize the joint. Also, the muscles that are above the joint, they act like shock absorbers to that joint. You know, and it's like the shock absorber or the shocks on your car, okay? And, you know, if you have bad shocks, you know, shocks that are weak, and you hit a pothole, that car's going to bottom out all of a sudden, all right? And that's kind of what happens to the arthritic ends of the bones if those muscles are weak. Whereas if you have nice, strong shocks, you're going to be able to ride over that pothole, you know, with a lot, it's going to be a lot more gentler, going to be a lot more smooth. There isn't going to be as much impact, okay? So that's how strengthening really works, all right? You know, you don't necessarily have to do exercises every day, all right? If you can do exercises 2 or 3 times a week, that's usually enough. You know, but with anything, you know, with any of these recommendations, you know, consistency is key, all right? So if you can kind of build up a routine, you know, every day or every Monday or every, you know, whatever, weekend, you know, that's the important thing, all right? So strengthening exercises, I found some of the simplest ones. The idea is that you can incorporate these into some of your daily activities, all right? So they're on the back of your handout here, all right? And we're going to go through these, all right? We talked about a recumbent bicycle, you know. So a recumbent bicycle is very, very helpful. You know, it is a strengthening activity, but with it being recumbent like that, it really helps take the stress off of your back. All right. You know, my recommendation for any type of activity is start low, build slow. Okay. So, you know, if you're walking or you're bicycling or you're swimming, you know, and say your goal is to be able to bicycle for 30 minutes at a pretty moderate resistance. All right. Do not get on that bicycle from the start and do 30 minutes at a moderate resistance. You're going to be really sore, all right? And you're going to be upset, and you're not going to want to do it again, all right? So what you do is you get on and you ride for 5 minutes at a low resistance, and then 10 minutes, and then 15, 20, 30 minutes at a low resistance. You build up. And then you go back down and do 10 minutes at a moderate resistance, and then 20 minutes at a moderate resistance, and then 30 minutes at a moderate resistance, okay? So say, you do that 20-minute moderate resistance, and that night or the next day, the muscles are really sore, more than that 3 or 4 out of 10, you did too much. You back it back down to that 10 minutes at a moderate resistance, or that 30 minutes at a low resistance, and you stick with that. And then you see if you can build up further, okay? Does that make sense? All right. So yeah, the key is not to get discouraged. Consistency is key. So if you want to do these activities, don't go out and overdo it, because then you're just going to get discouraged and not want to do it again, So you want to find, yes?
How does a water pill work in this?
It doesn't. Other than helping you to lose weight, if you have a lot of swelling from fluid, and you take the water pill and you lose 10 pounds of fluid, that's going to be 50 pounds less through your joints. But I'm not advocating water pills to lose weight, okay? But in general, yeah, they are not related to arthritis, all right? Okay, all right. Well, if you pee out a pound of fluid, it's going to be 5 pounds less through your knees. So you can be a little bit lighter walking back. It's okay, it's good. All right, so the exercises, okay? We're going to go through this together. So if you feel comfortable about it and you feel like you have your good balance, you can stand up, all right? I think the most important exercise is going to be what we call half squats, okay? And I'll explain. These are not deep squats, all right? These are very little half squats, all right? All right, so everybody stand up, and if you want, you can hold on to the chair, that's in front of you, all right? I don't have a chair. No, it's okay, it's fine. All right. So with the squats, okay, these are very important because they help strengthen your back, your hips, and your knees. So they're getting your whole lower body, all right? All right, so the key is you can hold on to the chair if you want. I recommend you do these if you're at the counter, like you're doing dishes, you're making food, or if you're brushing your teeth, all right? So you hold on for balance, and what you're doing is you're sitting down so that your butt is over your feet. So you're sitting down, straight down, and the key is so you go down slowly, but only go down halfway, and stand up, all right? The more slow that you go down, the more strength that you build up, all right? And if it's too painful to go down even halfway, then maybe you just start by going like a quarter of the way down, all right? Any little bit helps. And what you're doing is using your own body weight to help strengthen the legs. All right? Building up these muscles, these are all the muscles that you need to use to get in and out of a chair or in and out of the car. All right? So doing this is going to help you do those activities a bit more. All right? So these squats, you want to build up to doing 3 sets of 10, so that's 30 times, or that's about 2 minutes. So you can do it when you're brushing your teeth. All right? So if you feel like, you might not be going down, straight, you don't want to be bending over too far, you don't want to be bending over too far back, you can do what we call wall slides. So you can do this, against the wall with your feet on the ground. And what you do is you slide down slowly, only halfway, and then you stand up, all right? This makes sure that you're going down straight, all right? So this is something you can very easily do, like when you brush your teeth in the morning or at night, okay? So again, the consistency is key, all right? Something that you can do on a daily basis to help build and maintain the strength in your legs, okay? All right. Any questions about any of that?
So that doesn't.
You can all sit down.
Doesn't that put the load on your
It
knees?
puts load on your knees, so that's why you find a level that you're comfortable with. I know it's a little bit confusing because I had that slide on the squatting, okay?
Yeah.
So that's why, doing a deep squat, like even going down to a chair and back, puts a lot of stress. The farther that you go down, the more stress that you're going to be putting on your knees. So that's why if you can only even go down like a few inches or a quarter of the way, that's where you start, all right? And you do that for a few weeks. And then if you're comfortable doing that, then maybe you build up and go a little bit further, all right? And then maybe a little bit further, all right? And some people, they might only just be able to do a half squat. If it gets to the point that you feel good, then you can go even down to a chair. But, you start by going just a little bit down, all right? Do it 10 times, make sure you feel good with that. And then do it 20 times, and then 30 times. And once you're good with 30 times, then you maybe go a little bit further, all right, down, all right? So just, the point is, just try to do it, yeah, okay, all right. And again, a little bit of soreness is okay, like 3 out of 10, but if you're building up and, it's causing you more soreness than that, you're doing too much too quickly, all right? All right, oh, here we go, okay, so, all right. All right, and the next one, we can sit down, all right? Knee extensions, all right? And this really helps build up the muscles in your thigh that support your knee, all right? So everybody's sitting down here, and, I recommend that you do this like when you're watching your nightly news or Jeopardy, okay? A half-hour program. And with this, what you're doing, you're kicking the leg out straight, you hold it, and then you let it down slowly. And then you kick the other leg out straight, you hold it, you let it down slowly, all right? Again, the more slow that you go down, the more strength that you're going to build up, all right? So you try to build up to doing this like 10 times in a row, each foot, and then 3 sets of 10, all right? So that probably comes out to be about 5 minutes. So what I recommend is you do this, if you're watching your show for 5 minutes when a commercial comes on, all right? And then when you're watching your show, you relax, you rest, and then you do it for another 5 minutes when another commercial comes on, all right? And you try to do it for like 3 commercials, all right? So if you do this, when you're watching your nightly news for half an hour and the 3 commercials that they have, that'll get you all the exercise that you need for your legs, all right? So very simple, all right? I know if you've gone to physical therapy or if you have a personal trainer, they're teaching you exercises that are a lot more difficult than this. These are designed to be simple. They're designed for people to do on a somewhat daily basis, to help try to maintain and build that strength in their legs, all right? Again, the consistency is key. And, this is really how physical therapy works, all right? And that's why people, they go to physical therapy, they stretch, they do some strengthening, and it usually helps them out. It usually makes them feel good. But then they go home, and they're not doing those exercises on a regular basis, and then the symptoms come back, okay? So again, the consistency is key, And it's just like a diet. You go on a diet, and you lose a lot of weight, and you feel good, but then it becomes tough to sustain, and then the weight starts creeping back up. You want to find some consistency in it, okay? All right. All right, so these are the exercises mainly for the knees, okay? The ones for the hips, again, bicycle is very good. Swimming is very good for strengthening of the hips. Yeah, question in the back?
When you said to hold, is there a magic number, like 1?
No. The key is you just don't want to go, there's no magic number. And as you're getting, you can hold it for longer and longer, okay? But the key is just don't, do this, like that's probably going to aggravate things,
What about the toes up versus toes down?
Whatever you're comfortable with. Yeah, people had a question with that. I think the trainers, I forget. I think if you keep, actually I don't know. I think keeping the toes up gets you a bit more strength. I think it activates the muscles a bit more. But whatever you're comfortable with, try to do.
I was told that up is a flex, down is stretching the muscle back in place.
Yeah, so if you want to one commercial, do it with the toes flexed, and then the other commercial, do it with the toes down. You can alternate. Yeah, again, that's an advanced maneuver. That's where the therapists come in. I'm just trying to teach some simple exercises to keep the legs strong. All right. Oh, yeah, no problem. So again, with the hip, stationary bicycle, bicycle or swimming is good. Doing these half squats are very good. The one added exercise is this hip abduction. I didn't put it on your printout. I think it's a bit more difficult. And if you're going to try this, please do not lay down and do it on your bed or on the ground. But with this one, what you're doing is you're bringing the leg out to the side, you're holding it, and then you're letting it down slowly. All right. You bring it out to the side, you hold it, you let it down slowly. If you've gone to physical therapy, these are like how clamshells work as well. So you bring the leg out, you hold it, and you let it down slowly. Okay? Yep.
Why not the bed?
Well, it's just, the bed's fine. I think it's a little bit easier to do this like standing up as opposed to like lying down on your side. So, and I don't want you getting on and off the ground, repetitively, to do that. So, yeah, if you want to try it in the bed, you can. But I think it's easier just kind of trying to do it, with you standing up. Or you can do the clamshells. I didn't print that out, but Yeah, that's how the clamshells work as well. So, all right. So again, really good evidence, behind these. Neuromuscular training, which is essentially like physical therapy, exercise, how to manage arthritis, and physical therapy. It really works mainly through strengthening those muscles that are supporting, and providing that shock absorption to the joint. All right. All right. So any questions about any of these? Okay. Yep.
Not necessarily that. Does arthritis pain radiate?
It can, yes.
'Cause I get what I call accelerator foot.
Accelerator foot, yeah.
Because when I'm driving a car and put my foot down, I get a pain down here and in my foot.
It can, usually, so that's probably fascia. Fascia connects like the different soft tissues in our body. And that's what connects like, your body to your thigh, to your knee, to everything. So yeah, if you do some heat or massage or some stretching, it should help out with that. Yep. Yep. All right. I know it's snowing. I know people probably getting antsy. All right. So, so these are designed to be a day-to-day thing, that to help relieve some of the symptoms of arthritis, live better with arthritis, okay? This is like the very basic. So this is very hard to read. I apologize. But this is a treatment algorithm, for how to manage arthritis, as a doctor or physician. So what we've really gone through are these core treatments, which is education, simple exercises, maintaining healthy weight, to delay or prevent, arthritis from developing. All right. If you've tried these things, and you're still having soreness or discomfort, especially more than like 3 or 4 out of 10, the safest thing that you can try is a topical anti-inflammatory. So that's like a gel or a cream. The most common one is called diclofenac gel. It's also known as Voltaren gel. It's over the counter. It's in the same aisle as the Tylenol, Advil, Motrin, Aleve. It's been found to be very, very safe. It works really well for joints that are close to the skin. So it works very well for your hands. It works very well, for your feet, the knees, the elbows. It does not work as well for the hips or the back because they're encased in so much soft tissue and muscle. All right. But, using it on your skin, a very little amount gets absorbed into your body. So it does not have the typical side effects of taking an anti-inflammatory pill, and those are ibuprofen or naproxen, which is Advil, Motrin, or Aleve. Okay. Yep. Go ahead.
I just, for clarification, I'm not able to take ibuprofen.
Right.
Is the topical safe?
The topical safe, yes. Yeah. There will be warnings that you shouldn't, but in general, it is safe. Yeah. Yeah. You're just watching out for a rash. Okay. Everybody's a little bit different. You can always talk to your doctor that knows your personal medical issues, but I mean, unless you're developing like an allergic reaction to it, it's safe to take. Yeah. Yeah.
What was the alternative to Voltaren, you said?
It's diclofenac is the generic name for it. Voltaren is the trade name. They come in orange and white boxes. Diclofenac, Diclofenac. Yep.
Does Voltaren have aspirin in it?
No.
No.
No, I think there are some creams that have aspirin. Aspirin is an anti-inflammatory. Aspirin can thin your blood, though. People take it as a blood thinner. So, yep, good.
I too can't take ibuprofen.
Yep.
And I have a hip issue.
Okay.
What kind of topical?
Well, that's the thing. Hips are deep inside like that. So you can try, it depends. There's hip issues. There's pain on the outside of the hip. That's bursitis. That's not arthritis. The gel can be helpful for that, and you can try that. But if it's a deep, hip arthritis, which tends to be groin pain, it's not as helpful because it's so deep inside.
I've been using a cream, a hemp cream.
That's fine, yeah. There's different creams, there's Aspir cream, there's Arnica cream. A lot of people like Arnica. Everybody kind of has their favorite creams. There's newer like hemp or CBD creams. Those are fine. The creams are very low risk as long as you're not having an allergic reaction. The other thing is that you should avoid putting them in sensitive areas. So you should not put them on your neck or your face. You shouldn't put them in your armpits or your groin. Okay? And you shouldn't put them if you have a cut or a rash or a burn on your skin.
It's just a hit or miss kind of thing. Sometimes it helps and sometimes
it doesn't. Yep, exactly. Yep. All right, so if you've tried the topical creams, then the next you're thinking about, anti-inflammatory pills. And those commonly, ibuprofen, which is a generic name for Advil or Motrin, or naproxen, which is a generic name for Aleve. Okay. Arthritis is an inflammatory condition, so anti-inflammatories tend to work the best. The alternative is Tylenol or acetaminophen. It works differently than the anti-inflammatories. They can actually work better together, and they are safe to take together. The Tylenol or the acetaminophen works on your brain. The anti-inflammatory actually works on the inflammation, which is what's causing the pain and the swelling. All right. So you can actually take them together. The other thing is that if we develop arthritis, there's a lot of work being done on this, on how to better mentally handle that pain. So it tends to lead to chronic pain, and there are ways mentally to deal with chronic pain. Some people deal with it very well. They're able to kind of identify this as arthritis. This is causing pain. I can put it in the corner of my mind and forget about it. Other people, it's like a bullhorn in their head that's just on repeat, pain, pain, pain. And it dominates their life, it dominates their thoughts, it dominates, their emotions. And there's certain it's called CBT, or cognitive behavioral therapy. It's psychology. There's ways that you can do to kind of throw away that bullhorn and try to put those signals that are pretty normal into the back of your brain. All right, so you can talk to your primary care doctors about that. Potentially talking to a psychologist about how to deal with chronic pain. All right. So if you tried all those things, usually the next step is starting to get X-rays on the joints. That's to see how bad the arthritis is. And that's when you're starting to think about more invasive treatments. So that's either injections, braces, physical therapy, or surgery. Okay. So when we start getting X-rays, and if anybody needs to leave, I'm not offended. Please get up. I know people get nervous with the snow, ice, and such. So not offended at all. So these are X-rays. This is of the hips. Okay. This X-ray, so this is a normal hip. The hip is a ball in a socket joint. There is space between the ball and the socket. That space is that cartilage. That cartilage is what we talked about. That's what wears out with arthritis. And as it wears out, the bones get closer and closer to complete worn out, and it's bone on bone. So you can see that this hip has arthritis. That joint space is gone. As that cushioning from the cartilage wears out, the bone reacts. It forms bone spurs. So you can see spurs here and here. It also hardens, and that's why this is a lot whiter than this one is. Okay. So if you tried all these treatments and you've gone to therapy, maybe even tried an injection, and the X-rays show you have bone-on-bone arthritis, then the options are to kind of live with it or consider surgery. And surgery would be a hip replacement surgery, and that's where you're replacing the arthritic ball and socket, with a metal plastic ball and socket. Okay. It's very effective at treating the symptoms of hip arthritis, but it's also the most invasive and has the most risks.
I got a question.
Yep.
Okay, if a person's got osteoarthritis in the hip, and an X-ray showed there was a bone spur,
Yeah.
does that mean there's no more cartilage?
Not necessarily. A bone spur just shows that there is usually some wear in the cartilage. It's very common to have little small bone spurs around the joints. The spurs themselves do not cause symptoms unless they're very, very big. Can
a bone spur impact on a nerve and cause radiating pain?
if it's incredibly large, and it needs to be an inch or two. Okay.
That would show up on an X-ray?
Yes. Yeah.
Is that something that you get involved with when you do surgery?
Yes.
Can you remove bone spurs?
Yeah. So usually when I'm seeing patients is that they've been dealing with arthritis and we're getting X-rays. We get X-rays pretty much on everybody. If you're going to be getting, and this kind of goes to these more aggressive treatments with the injections, my general recommendation is that there's a lot of marketing, there's a lot of advertising out there. If you're going to be having a treatment that is costing you out of pocket many hundreds or thousands of dollars, you should be getting an X-ray to see how bad the arthritis is. All right? And the general recommendation is if you have bone-on-bone arthritis, a lot of these other treatments are not very effective.
If you just have symptoms that come and go, would that mean it's less severe?
Yes, yes. So the tendency with arthritis is that the symptoms come and go. You get an occasional flare, okay? And that's what we're trying to avoid, is like avoiding the flares. And then that becomes more common, and then it starts to become more chronic, like the pain does not go away, and it gets worse and worse and worse, okay? So usually if it's bone on bone, and pain is more or less constant all the time, you know, and there's certain things that cause it to get aggravated, yeah. So that's, you know, yeah, go ahead.
When you talked about possibilities of medication and all that, you didn't say anything about hydrogen.
About what?
Glucosamine and hydrogen.
Yeah, so glucosamine and hydrochloride. Yeah, so that, that's a good question. You know, there is no good evidence that those work. Okay, there have been many studies.
What did he say?
The glucosamine and conjointin. It's like, you know, the joint health medicines. Okay. So the thought is that, you know, those are the building blocks of your joint fluid. You know, so that's like the WD-40. All right. And the thought is that you take these pills. They go through your body into the digestive system, and they somehow find their way to that arthritic joint, okay? So it's theoretical, right? They've done studies that they've taken half the people and they've given them those medicines, and they've taken the other half of the people and they've given them just sugar pills. And they found that there's been no difference between the two, all right? But what I would say is that, you know, some people swear by them, and they actually are very effective in animals, you know, and yeah, so like, so if you want to try them, there's usually very few downsides to trying them. They do not affect organ systems, okay? Most people don't have an allergic reaction to them. So they are safe to try, you know, and if they're going to have an effect, you should try them for several months. It takes several months for them to kind of build up in that joint. So what my recommendation is, if you want to try it, you find, you know, the medicine, you know, that's affordable. You're not breaking the bank on it. And you take it for like 3 months, you know, and if you haven't found a difference, stop taking it, all right? But if you find it helps, then it is safe to usually continue taking those. But there's no good evidence, you know, behind those things actually working, you know, and I'm mainly talking about evidence-based treatments here, yeah.
Turmeric is.
Turmeric actually has good evidence behind it, yes, yep.
Thank you.
Yeah, go ahead, yep.
I've had severe arthritis in my knee.
Yeah.
And X-ray, I was told, was bone on bone.
Yeah.
And a friend of mine had told me that he was taking glucosamine and turmeric.
Yeah.
And his doctor had recommended it, so I started trying it.
Yeah.
And it's worked for me.
And that's why I'm not saying don't try it, because I have patients too. They come in, they swear by it, they even try it. They try it for 3 months, and then they stop taking it, and then their symptoms are worse, you know, and so they continue on it. And so that's the thing. It's like I'm not advocating against it, but there isn't good evidence behind it. But some people swear by it, you know, and if it's something that gets you by, you know, and keeps your symptoms, you know, controlled, there's usually no harm in continuing it, yeah.
Related to...
Yeah, hold on, yeah, go ahead, yep.
Is the collagen powder on the same
Yes.
scale as the...
Glucosamine conjoint, yes.
Yes.
Yeah, there's no great evidence behind it. If you're going to try it, don't, you know, spend too much. Take it for a few months. You know, if it doesn't have an effect, stop it, yeah. But it's the same, yeah, same principle, yep. All right, other question, yep.
I have a bone-on-bone in my knee.
Yeah.
I use the topicals or
Yep.
whatever, and I can live with it.
Good, okay.
Does it always get worse? I mean...
Not always, you know, so that's why we're going through, you know, these pillars here. This is, you know, what you can do to help it from getting worse and continuing to live with it, okay? You know, where I start recommending that people get more aggressive in their treatments is if the arthritis is causing them to move around less, you know, the muscles are getting weaker, or that joint is getting stiffer. Like you can't fully straighten it, or you can't like fully bend it, all right? Because if it's starting to get stiff, you know, that's when you start, you know, thinking about injections or therapy, you know, or surgery. You know, because if you wait too long and those muscles are too weak and too stiff, there's only so much that you can get back with those treatments. Okay? Yeah, go ahead.
I have arthritis everywhere, mostly in my lower back.
Okay, yeah.
And when it starts to hurt midday,
I sit with a heating pad
Yep.
and it goes away.
Yeah, moist heat is very good.
My question
Yeah.
is, a lot of the topical medicines say not to use heat, so I can't use that? I can't use both?
You shouldn't use them at the same time, So, you can use the moist heating pad, for like an hour, and then you can put the cream on after that. Okay? You shouldn't put them on at the same time. Yeah, moist heat is very good for long-term arthritis treatment, all right? If you have an injury, like you sprain your ankle or you get an arthritis flare, ice can be very helpful for a few days for that. But more of the long-term chronic pain actually works, the moist heat works better, all right? You can get a heating pad. Some of those heating pads have like a towel covering, and you moisten that, wring it out, and put that there, or on your knee or on your hip. That can be helpful, yeah.
How about a sauna?
Yeah, sauna. So that's why, and it's why like getting a warm shower usually helps out, or sitting in a sauna can be helpful. Yeah.
Would a TENS machine help?
There isn't great evidence behind that. The TENS machine actually works by stimulating the muscles to get them to fire. So it's kind of a fake way of creating activity in the muscles, So but yeah, so that's how they work. They kind of stimulate the muscles. I think there isn't great evidence behind them though. So I know therapists use them a lot. There's mixed evidence behind it. Yep. Yep.
How about salon pass or those patches?
Yeah, those are fine to use. I think some people swear by them. I think if you find something that works for you, there's no harm in trying it. But yeah, I haven't seen great evidence just on the salon pods. Yeah. In the back.
As far as turmeric anti-inflammatory, is it better to take it at night or
So
in the morning?
if you take an anti-inflammatory, you should take it with food in your stomach. That is my recommendation. So you take it in the morning after your breakfast. You take it in the evening after your dinner. All right, that helps reduce the side effects on the stomach and the intestine. And you should stay hydrated during the day. Try not to get dehydrated. That helps reduce the effects on the kidneys. Okay?
I've been taking turmeric for 10 years. I've found it.
Turmeric is, so that, I think it's, if you take it on with food in your stomach, it's good, but that's not, the anti-inflammatories, that's like Advil, Motrin, Aleve, ibuprofen, naproxen, And there's prescription ones that are designed to be easier on the stomach and intestines. Yep.
I was just gonna say, because a lot of people are mentioning turmeric, isn't turmeric a blood thinner?
I don't think it's a very strong blood thinner. I think you should ask your doctor if you are on a strong blood thinner, if they think it's okay. In general, I think it's probably fine. But if you're going to be taking it daily as a supplement, I would talk to your doctor. And you're on a strong blood thinner like Eliquis, Xarelto, or something else, for your heart, I would talk to your doctor about that. Yeah. Good.
Knee replacement surgery.
We didn't get to it. So that was the hip. These are the knees. All right, go ahead.
Is there anything new in the horizon to make the process easier?
So a lot of the developments, in joint replacements, the techniques have improved a little bit. You might hear about robotics. Robotics haven't necessarily improved, patient outcomes. We've gotten better with controlling pain, getting people moving quicker, which speeds up the healing process, giving people medicine to help reduce the blood loss. The implants have gotten a little bit better as well. There's nothing major on the horizon, though. Yeah, so no, we've gotten pretty darn good at doing joint replacements. A lot of, I think, the improvements have come more from how to manage the patients as opposed to like the surgeries themselves. So. Yeah. Thank you for coming out. Yeah, so with the knees, again, I gave you an x-ray. This is a normal knee. All right, good space between the bones, okay? This knee, you can see worn out, bone on bone. There's some small little bone spurs there, okay? See these little small spurs? Those are not going to cause any symptoms, okay? So if the knee is worn out and it's bone on bone, and you think about knee replacement, they come in two varieties. There's a partial knee replacement and there's a full knee replacement. The partial only replaces part of the knee. The total knee replacement replaces the full knee. And it really depends upon where your arthritis, symptoms are, where the arthritis is on x-rays, and kind of what medical issues you have altogether, but that's, the knee replacement, and with any joint replacement surgery, like I said, there are big benefits to them, but there's also big risks. And the whole goal is to minimize the chance of having a risk, okay? So there's certain conditions or patients, that I think it can be unsafe to do surgery. If patients are excessively overweight with a BMI over 40, if their diabetes is poorly controlled with an A1C over 8, if they smoke, if they have an active infection in their body, if they have an infected tooth that needs to get pulled out, if they're very malnourished or anemic, meaning a really low blood count, if they're abusing substances or they have uncontrolled, mental health issues. And then if we're doing one of these injections into the joint, you can't have surgery within 3 months of that injection. It really increases the risk of developing an infection. And that's really the big risk that we're trying to avoid is infection. If you can get an infected joint replacement, it's worse than having most cancers. So it's very bad, very detrimental, and really what we're trying to avoid. So, the best outcomes, are when patients, are optimized, and it is safest to proceed with surgery. So, all right. But again, I kind of told, another group about this is that, how I think about joints, I do joint replacement surgery, that is my specialty, but it is a last resort. These are big surgeries. These can be risky surgeries. They're kind of barbaric when you think about it, We're going into the joint, we are sawing off the ends of the bones, and we're replacing that with metal and plastic. I think in 30 years, they're doing a lot of work, with genes and genetic editing, and they're finding out, what these risk factors are for developing arthritis, and they're developing very targeted treatments for those specific patients. And I don't, it's probably not even going to be in my lifetime, but in like 30, 40 years, they'll be able to give, if somebody, they have, a genetic predisposition to developing arthritis, and then give them a medicine, and then their joints are healthy and they're running marathons until they're 90. And they're going to look back at all these joint replacements, and they're going to compare it to when they used to drill holes in the skull because people had a headache, And now we just give people Tylenol, right? You think about, you have pain in your head, just drill a hole in there and relieve the bad humors. We have, but I think honestly, in 30, 40 years, we're going to be looking back at this and say, like, this is crazy, But unfortunately, the joint replacements, they are the best long-term treatment for, end-stage arthritis that we have at this time. So it really should be a last resort thing. So, okay, go ahead.
If you've been told you have bad bone density, and you have osteoarthritis,
Yeah.
what kind of exercises? I mean, like that
Yeah.
for me, I'm kind of fearful for doing some of these things.
Yeah.
I don't want to break something.
No, so you want to avoid any falls or injuries. In general, what helps with osteoporosis is strengthening exercises and weight-bearing exercises, okay? So swimming, while it's a strengthening exercise, is not a weight-bearing exercise. Bicycling as well, it's a strengthening exercise, but you're not putting a lot of weight, okay? So weight-bearing exercises are, walking, treadmills, hiking, and then the strengthening exercises. By you strengthening the muscles that attach to the bones, it helps strengthen those bones. But then you're also usually thinking about supplements, and calcium and vitamin D. You need both of those, okay? You take the calcium to build the bone, but you need the vitamin D to absorb the calcium from your gut. So you need to combine the two.
Can you do a joint replacement if somebody's got bad bones?
Yes, we do it all the time. Most people have bad bones. It's just there's certain techniques that we use in people that have weak bones versus people that have strong bones. But yes, just having osteopenia or osteoporosis does not mean you can't have a joint. If it's really, really bad, then we usually recommend that you try to get the bones a bit stronger so that the implants, you don't break the bone or the implants don't loosen up from the bone. But yeah. Go ahead.
Do you have a lot of arthritis and that have it be harmful? It's just there and not doing nothing.
I'm sorry, what's your question? So if you have a lot of arthritis, is it harmful?
Well, not so much money, but they took MRIs and they said my spinal column was loaded with arthritis.
Uh-huh.
Would that be there and not do anything, or just be there?
Well, like I said, arthritis, it's a common thing. Is it in your back you're talking about? Yeah, so that's what I say. Like most people, have in their back. Almost everybody develops it. Like 100%. If you get an X-ray of your back and you're 60, 100% you're gonna have a little bit of arthritis in there. So it's a normal process, But like I said, trying to keep moving, trying to keep the muscles that support the spine strong, trying to keep the weight healthy. Those are all things that can help with arthritis. Moist heat is very helpful for the back. Swimming can be good, yoga can be good. A lot of these exercises, a lot of these classes that you have here. And again, another plug, these classes are all about keeping moving, keeping strong, and maintaining your balance. So fitness room, balance training, the chair exercises, the stretch and the strengthening, silver sneakers, strength circuit, Tai Chi, and yoga. A lot of classes that you have here on a regular basis, to try to keep you moving, try to keep you strong, try to keep you balanced. So yeah. You're welcome. Yep. All right. Any other questions?
No.
All right. So, yeah. So thank you very much for coming out. I appreciate it. I'll be around here for a little bit if you have personal questions. But thank you for coming out. Really appreciate it.